Hi, everyone. Welcome to Learning by Leading, a podcast where we speak from the inside out, where we talk not just about the work that we do in the world, but what it takes for us to keep going. I am Shubhangani, and I'm here with my friends today, Joshua, Aindriya, and Harshita. Today, we're going to be talking about something that a lot of us in this room have been feeling, but have rarely said out loud. I'm talking about the emotional and mental toll of holding space for others. In our roles as peer supporters, as facilitators, as program leads, as people who are able to hold space for others in a way that we are open to vulnerabilities, there are times when the balancing between holding others and ourselves becomes a tricky thing to navigate. I can tell you very honestly that for me, as somebody who's been designing programs, working with queer trans communities, sex workers, a lot of marginalized people, it has been a journey to be able to hold myself and to do it consistently. A little bit about myself. I've been working in the social impact sector for about 6 to 7 years now. I started writing about issues of gender, culture, politics, and how they related to me and my identity and my life. I also got interested in using art and particularly comic making as a tool for resistance. And on a whim, one day started a comics page called The Killjoy Cat because I was reading Sarah Ahmed's Feminist Killjoy and it related a lot to me and how people kept referring to me every time I pointed कि ये गलत है, ये sexist है. Then I moved to working with queer and trans people and sex workers at an organization in South India, where I was leading, designing, co creating programs around health equity, gender equality, and sexuality rights. And today I get to work with young people on abortion rights and justice at the YP Foundation. Throughout this journey, I have had the privilege of working with and leading very diverse teams with respect to identities, our experiences, and even our entry points into the sector and the work that we do. I realized very early on in my leadership journey that for me, being a leader would mean to integrate care in the everydayness of our work. This realization also came because a lot of us in the sector come with our own experiences of trauma, of hardships, of having faced violence, having seen lack of acceptance from natal families, and our workspaces become a source of finding community and friendship. I can attest to it because I have found some deep, lifelong friendships through and at work. And I was thinking if that is the case, that we seek community, we derive validation and respect, find joy in the work that we do. How can I, as a mentor, as a lead, enable all of those for the teams that I work with? Integrating care for me then has meant things like listening to my people with a lot of intent and curiosity, holding spaces for open dialogues, holding regular check ins to just be like, how are you? And to be able to allow a space where my team can also ask me, how am I? It has also meant co creating work that we have found meaningful, true, and that is built on the expertise and experiences that we all have. This has not only happened in the rooms of organizations that I've worked with, this has also happened during chai breaks, during field visits, in our journeys on trains and buses, where we have realized that we need to be the people for each other that we want others to be for us. And while I have been able to constantly create spaces for others, and I continue to do that, it has been difficult for me to come back to myself, to check in, and to see how I'm doing at regular intervals. There is a tendency for me to constantly work, burn out, and then crash. I was talking to my therapist the other day where I was telling her that I don't know why I don't rest. And she said, maybe you're resting, but you're not relaxing. And the difference was that, yes, I can lie down for a couple of minutes at work when things get overwhelming or when I feel that I need to step back from a situation, but my brain is still running. And that is something that I'm still figuring out, which is the reason why I feel the conversation that all of us are here for today becomes so important. All of us take roles of supporters, whether it's with regard to mental health, as program leads, as people who are mentoring younger people, as people who are in some positions of power. And we're also looking for a kind of role model for ourselves. What does it mean for us to be seen and listened to, especially on days when you're exhausted, when there are so many deadlines piling up that you don't know what to do? There are also days when I'm not able to articulate what is happening and I feel like I'm simply done. And today's conversation is about that. Joshua, I know a lot of what I've spoken about shows up for you too, as somebody who works in mental health. You lead, facilitate, and show up for so many people. What does the emotional cost of being someone others rely on look like for you?
Thank you, Shubhangani. Yeah, the quite a heavy question to sit with because definitely the emotional cost and the labor of having to show up for people and be dependent on is quite real, is quite a lot. Not just for me, but also for the people I work with who are also in the field of offering support and stepping in for emergencies. So, especially when we're working with queer community members, those who are neurodivergent, which is the community I mostly work with, there's always going to be someone who's dealing with a crisis, someone who's going through something urgent. There's always going to be something, some conflict to have to respond to. And oftentimes, it's not conflicts or crises that we're completely distant from. We're not stepping in as outsiders a lot of the times. We're also part of these crises and conflicts. These are things that also affect us. These are also things that are also happening in our own houses, in our own families, with our own jobs. So when we're holding space for people, it's not just their needs and their feelings that we're dealing with. Sometimes it's also our own. Like I'm also burning out sometimes. I'm also grieving maybe loss while I'm holding space for someone else's loss. I'm also struggling maybe with like acceptance or maybe with like autonomy while having to support someone who's going through the same thing. And it gets really hard when people see you as a leader and can handle things or see you as someone who's mature or trained, all of these things. And I mean, not denying that I am all of these things sometimes. But I think the expectation is that we are perfect, that we are always available, that we're always present and aligned with what people need. And that can get really exhausting and really dehumanizing sometimes. So it does feel like I'm seen for my skill or for my role, not for who I am as a person. And that's the difficulty of working in community with community, is that sometimes we have similar needs, but the needs of the people who are expected to step in as supporters, as listeners, as sometimes as counselors or emergency sort of intervention workers, there is that expectation that our needs are manageable, and that's why we do this. There's this assumption that we can handle it, and so we do it, and that can be sometimes quite difficult to navigate. And especially when we're working with our communities and we're part of these communities, a lot of queer people, including us, don't have safety nets to fall back on. We don't have maybe sometimes families that support us. We don't have maybe savings that we can rely on. So when we're talking about mental health crisis and burdens, we're not just responding to like an emotion or a feeling or an incident. We're responding to everything to do with a person's survival sometimes. And that can mean a lot of work beyond just listening. There can be sometimes having to do with resource mobilizing, having to connect to other trained professionals, having to support with legal, maybe advice or legal help, maybe having to look to connect people to a shelter in a city if they're trying to escape from home or escape from a difficult situation. So there's so much about survival sometimes that we are also working on, and then that can be even more exhausting. So what's kind of helped us navigate this very important work that we love, but also that can take a toll if we're not careful, is just having care built into everything that we do. Whether it's maybe like we do weekly check-ins for one of the groups I'm in where we just share about how we're doing. It has nothing to do with the work, but it just helps us understand the context everyone is coming into or coming from when we come into this work and we support other people. What are we bringing with us? Who's going through a breakup? Who's going through loss? Who is maybe finding it difficult to find a job? Who is maybe like questioning their gender identity. So it's like we understand where we're coming from when we come into this work, and that makes it easier for us to maybe measure our capacity and step in accordingly, or step up on behalf of someone accordingly. Sometimes, because we do run a peer support group where we offer mental health support to people, sometimes we have sessions just for facilitators, just for maybe the group leaders, because we also need that support from each other. So what we try to do is once a month at least have that space just for us, that so that we are also benefiting from the care we give other people. And what we do is also we take turns to step back or step in, so that we are intentionally allowing each other to rest. So these things kind of really help us navigate how exhausting it can be sometimes to do this work, while also making it rewarding. As much as it's exhausting, it also is rewarding when we do it with care, when we do it with sustainability. Aindriya, you also work closely with neurodivergent folks, and you've spoken about how care has to adapt to different ways of being. So what does that look like for you? And how do you balance your own needs as a leader?
Okay, I feel like I need to give a little bit of context in general also, because for me, sure, is somewhat of my own way of caring for myself also. Because like what show does is that I try to like build AI tools and different other kinds of tools to identify online hate speech and try to remove it from social media and basically from the internet in general, in the context of India and the different languages, and what are the specific kind of languages or abuses used against marginalized folks. And that started because I was myself facing that. And for me, starting Shore was how I was coping with what I was also going through. So that itself was a mental health journey for me, from going through breakdowns because of TFGBV online to thinking of trying to build something. And that has also helped me understand like what kind of a leader I want to be, because I was an AI engineer at a startup and I hated working there. I hated going to office every day and attending meetings and like being my best self and having to talk to everyone. And and at that time I did not even know I am neurodivergent. And in fact, like what work has helped me a lot to understand that I am actually neurodivergent, because I was added to the ADHD people, and that has been a huge part of my mental health journey. And so when I left, and like I had like this whole phase of burnout, and then only I slowly understood I am neurodivergent, and I cannot work how like the capitalist system expects us to work and show up every day and be our best selves every day. I would rather like have one period of hyper focus where I do a lot and then I don't like get out of my bed for a long time. And that is just how like I have realized my pattern is, and that is how my body works, and I have to value that. So now when I am in a position where I have people working with me, for sure I know that the environment where tech is usually developed is not usually neurodivergent friendly, because I could not survive in that environment. But that is also what we were taught as software engineers, that okay, we need to have scrum calls every day and we have to have these meetings and updates and Jira updates of what you're doing and all of that, and email threads. And that is what we learned in BTech for 4 years. And then like going through that process of understanding that okay, this thing does not work for us, and then realizing that okay, this was not a flaw in me, but this is just how we are wired differently. And now that I work with a new set of people, I have not learned in my BTech how to build a tech product in with this kind of people, like of our kind of people. So this is something I have had to try to figure out on my own. And what I again realized is that okay, I try to tell my bosses before also when I was in jobs that I cannot attend meetings every day. So now I try to listen to the people who work at Shore. If what do you need? Like, it might not be the same needs as me. So I can't just be like, okay, we won't have meetings, because that is just my need. But someone else might actually want a schedule to be able to work. So I try to like keep asking a lot of these questions, and I also try to be very like non-hierarchical with the team. So what I have is a Discord server, and I have like multiple channels for the entire team, where there's work channels also, and there are also like mental health channels, and there are like just ranting channels, venting channels, memes, and all of that. And and I give like equal importance to all of those things, not just the work part, but also the mental health, just random resource sharing. And also I have like a constant body doubling going on, where people can just join if they want. So these are the things I have slowly understood. And I've also seen how like things kind of clash, because sometimes I don't want a schedule, but people ask me for a schedule because they need a schedule, and then I'll have to figure out something in between. And for me, like sometimes I just get very tired of all of that, and like I cannot keep the conversation going and do all of that, and I just vanish for a while, and then come back. And I've also learned to not be guilty about that. So I just like, whenever I come back, say after like 2 weeks, I'm returning to the team, and I'm like, yeah, hi. You should expect this by now. And I also expect this from you. Like, I don't expect you to have like a very fixed timeline of when are you going to have this deliverable, but rather I try to. But also, since we also get anxious if we don't have anything at all, and we do need like something, so what I ask for is a loose plan, where we have like a lot of time to rest in between, and like not be, we expect that we will not be able to meet that deadline, so we keep it loose like that. That's what I try to do. But it is also very challenging that way, because the kind of system and society we are in, we need like specific deadlines and specific like, oh, even if I'm pitching to someone what show does, I need to say that okay, in this months I've done this and this and this, and I have to show these numbers, which is literally like not possible if I am trying to build something which is different than what I didn't like, what I myself couldn't survive in. So I try doing that, and a lot of times I just feel like I'm not doing anything. And I feel like nothing is happening and no one is doing anything in the team. And then I cry. So, and then I go back to it, and then I like write long messages in the group. And then like, and people come back again. But now I've just realized that that is just how it's going to be. So, and that is also what I've seen, that I have to understand my own patterns and the patterns of people, other people also who I'm working with. Like, what, like I know by now that I only work when there are certain deadlines, say, for example, or I know that I cannot have a fixed period of rest. Then I'll stress about when it is going to end, or if I'm resting productively enough. Like, am I drawing when I'm resting? Am I doing something important when I'm resting? Or at least am I watching a show that I'm enjoying? So I get stressed about resting also. So, so now I know all of those patterns about me. I'm not saying that I have solved all of those things, but knowing that I do that actually helps me to manage how I'm feeling. And now when I feel like, oh, I'm not resting properly, I know that, oh, this is something I usually feel, and that is like a internalized capitalism, and I try to cope with that and get back. And I, if I know that there are patterns, I can only work on deadlines. Sometimes I ask other people to give me deadlines. So I try to figure out what works for me. I know that the set rules that we have learned in our books and what people have told us about productivity are not going to work for me, especially in a tech product where they want very specific numbers and very tangible deliverables. It becomes extremely difficult to work with neurodivergent and disabled folks. But this is something I am trying to figure out on my own, because there are no set path given already. So what I try to do is, when I figure out something or whatever is my journey, I try to write about it, so at least other people know if I figure out something, or at least other people find something that they can relate to. At least, they don't feel like something is wrong with them or their journey, which I've done for the longest time, until I found Josh's group. I'll keep doing shout outs to ADHD people. Harshita, I want to bring you in here. You're in healthcare, where care is supposed to be central, but often feels systematized and distant. What have you learned about care that institutions forget?
Thank you, Andrea. That is such a powerful question. I think one of the biggest gaps in medicine is that we're taught and trained to treat people, not to hold them. A little bit about me. I wanted to be a doctor since the age of 4 because I wanted to provide people with hope for a better tomorrow. The renewed hope that patients have for their life, their future, when they start recovering, the pure, unadulterated joy that you see on their face. I knew that there was no other profession that could give me as much happiness. And so it has been my dream since the age of 4. And now, having graduated from one of India's top medical colleges, I can say that dream has finally come true. But learning about health every day, I keep going back to the definition by WHO, which says that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. But medical education is still so inherently based on Western and patriarchal models. We learn about symptoms and diseases, and not stories. We're taught to fix. And in a country like India, which is quite strained with resources, we're often very overwhelmed and overburdened that we no longer feel. It's like we're going through the motions, working like a robot. And this makes it really hard, quite challenging, in fact, to even talk about care in a way that's relational, community rooted, or even gentle. But things today are shifting slowly and steadily. Our curriculum now includes 8Com, attitude, ethics, and communication skills. And I see younger doctors and students creating peer listening spaces, asking deeper questions, advocating for mental health and well-being, and extending empathy in their daily practices, whether at rural clinics, amongst trans patients, or even to each other. For me, care is something I learned from my mother every single day. She taught me that we treat people, and from her, I've learned that it means presence. Just being present in the moment, slowing down, listening without rushing to solve, remembering that every life we interact with is a sum of its experiences. And that's what makes it so unique. That's what makes each of us alike, but still different. That's what makes all of us special. With that, let's take a short break here. Before we wrap, I want to ask each of you, what's one practice or shift that's helping you sustain yourself in this work right now?
I think for me, it has been a radical acceptance. I think that is what it is called, radical acceptance of like the entire chaos of everything that comes with it. A lot of the time, trust me, I'm just crying. Just I'm just in my bed crying and saying that I'm not doing anything, and like everything is a big failure and there's no point of doing anything. And then I get up after crying a lot. And I have periods of very like low emotional and mental bandwidth, and then I slowly recover from it, and there is like no fixed time limit to it. And by now I know that it's kind of stressful knowing that I don't know when this is going to be over, but I just let myself be in that period, and eventually some like I get inspired again. Probably like my brain, when it gets enough rest, it gets up again, but I don't know when that happens. And radical acceptance also in the fact that there is going to be these periods and I'm not going to be good at everything and I'm not going to be able to do a lot of things, for which I have also learned to ask for a lot of help, like constantly asking for help. Like, and also for the little things which I used to be very ashamed of, or embarrassed of not being able to do. Simple things as laundry or picking up things and like keeping my things in place. And it has been a huge like, and you know what, like we have been taught a lot that we have to do everything on our own. And even through mental health, it has been made into this whole like self care and self journey and everything. But for me, like I have done a lot of self care journey and everything, and it has helped me go on. But it, in the end of the day, I would get very burnt out. But for me, like being able to have people around me who understand and can provide the care without making me feel like I'm not enough for not being able to do some very like normal simple household chores has really helped me. Like being creating that kind of a safe environment around me where my basic needs have been met has really helped me to do things I enjoy doing, like painting or doing something creative or writing a piece of code or coming up with a new idea. It has all happened because I have surrounded myself with people who have made me feel safe in my environment and helped me do tasks that are easy for them but very difficult for me. And for me, I would feel really bad that they have to do it, or I have been taught in my family that why can't you do all these things, why someone else having to do this. But I've learned that there are people who are willing to do that, and I'm grateful to them, but they also enable me to do everything else. And being able to accept that help without guilt has really helped me.
Yeah. I think similar to you, Aindriya, for me, a lot of being surrounded by people who genuinely care about me, who step in to support me has helped. I feel like I'm still learning how to reach out and ask for help or to sometimes just step back and not do things. I think there's that fear always there that, if not me, then who? And I feel like that's something I'm actively trying to unlearn. So, what I'm trying to internalize lately is that people and their problems will always be there. You take a step back, people are still going to have problems. You come step in, people will still have problems. They'll just be more supported in their problems. So I think for me, it's trusting that people can also take care of themselves. They have their own resources. They have other people in their lives. They have their own thoughts and their ways of dealing with things. They have their own coping mechanisms. So for me, it's trusting people to exercise agency about their own mental health and knowing that even when I do not have the capacity, people grow and learn in their own ways to step in and step up for themselves and they find other ways. It's been difficult sometimes for me to see that when I take a step back, people rely less on me. It used to be really difficult because I'm like, oh no, I'm blocking them from access to my support and something good that they could have access to. And now really reframing it as like, oh, it's not about me. It's about them and how they choose to maybe find support and deal with things. And that's been really helpful. That's kind of helped my relationships also be more sustainable. I think something that we do in one of the collectives that I'm a part of, where we do peer mental health support groups, is we have weekly check-ins, like I talked about, but also we are very intentional about we only schedule sessions if the facilitators have capacity. If we don't have capacity, we don't schedule anything. So it's like the work doesn't have to be done. It helps. I'm sure community members would love it, but it's like if we stop doing something for a bit and just tell people we're burnt out and taking a break, what's the worst that's going to happen? I mean, I can think of all of the horrible things that could happen, but genuinely speaking, it's like life goes on. And something I sometimes in my own workplace, also at this NGO that I work at, I tell my boss, like, unless it's a life or death situation, nothing is ever an emergency. Nothing's ever that urgent. Unless, of course, like the entire organization is like affected, then maybe, yeah. But it's like, why are things so urgent? Why do things have to be done so quickly and by a certain time? Why do things have to be done sometimes perfectly or incredibly well? Can we maybe think about prioritizing our well-being, our capacity, rest, and doing things in a way that is enjoyable and sustainable without it having to like completely drain us dry? So that's kind of help, where we are a little kinder to each other about things just not going well or things going badly. Other than that, what helps, I guess, for me is just taking space to talk about what's happening to me with people and practicing how to be emotionally vulnerable, learning how to cry around people, learning how to, do the same thing that I do for other people, but letting people do that for me. I think for me, that's been a huge help in this journey of like, it humbles me also, because otherwise I can get really high and mighty and think really highly of myself, like, oh, I can handle it. Even if I can, I shouldn't always have to handle it. So I think for me, a big step has been learning how to just be weak, and learning how to struggle and be okay with it, and learning how to, sometimes allow myself to struggle, because sometimes it's like, no, I can be strong, but why do I have to be strong? So I think that's been something that my friends have challenged me about. They're like, why do you have to be God? You're not God. You don't have to always have the perfect response, always be there, be human. The reality is just probably just, yeah, just that expectation of like, if not me, who will? So many people will. So many people have so many skills and so many resources and so much like warmth and intelligence and capacity and empathy in this. The whole point of being in community is that there's community. So I think that's just really helped me. So yeah, so that's me. So Shubhangani, I'm curious about what other things that kind of help you navigate your or sustain yourself doing this work.
Thank you, Andrea, Joshua. I related so much to so many things that you said. One thing, when I was thinking about what is that one mechanism that I keep going back to in these 6, 7 years of work across cities, is talking to friends, talking to people who love me, who I love dearly, cooking for them, eating with them, has been really, really important. There are times when I am not able to handle a situation. There are times when I don't feel good. Knowing that a friend is just one text away, that we can just meet in the evening for a cup of chai and yap our hearts out. I think that has been a lifesaver, if I can say so. There are times we unravel situations together. They won't know what's happening in my life, and I'll be like, I'll place these characters and I'll tell you the story. You tell me what is happening. And because it's a space of mutual love and respect, they see me as who I am, but they're also able to hold me accountable with a lot of care. And I really appreciate that, to be in a space with people who trust you, who see you in the ways that you want to be seen, but not without criticality. So it's a very safe space that it becomes. There are also times when I am scrambling for words, but I have so much to say. There's so much messiness that comes in our interactions and so much complicated things, and we talk about it layer by layer, these narratives together. And that exercise, those conversations, those rants, whether virtually or in person, have been something that I've gone back to. And that has truly sort of saved me in a lot of ways, if I can think about. Yeah.
Thank you, Andrea, Joshua, Shubhangini. So, what I do sometimes to check in and keep myself sane through everything is while people use social media, I love scrolling Pinterest to find aesthetic mood boards and oftentimes quotes. So my wall is filled with these kind of quotes. I have one right now that says, "No problem or challenge will stop me. Everything I deserve is coming my way." I'm also quite addicted to Disney movies. I'm talking about the old animated ones. And Disney always reminds me that no dream is too big. And even in the darkest of times, there's often light. Though I do know that quote comes from Harry Potter. But yeah, it kind of just puts a smile on my face. So thank you, everyone, for this conversation. It is such a reminder that care isn't about being endlessly available. It's about being real, authentic, honest. We've all spoken today about the cost of showing up, but we've also seen what's possible when we're allowed to pause, when we build collective practices that hold not just others, but ourselves. If you're listening and you're tired, exhausted, or burnt out, please know that it's completely all right to take a step back. The work can wait. The revolution can wait. You don't have to burn to keep others warm. We'll see you again soon, but until then, hold each other. But don't forget to hold yourself too. Bye.